Welcome everybody. I'm Peter Hudson, the Director of the Centre for Palliative Care, which is based at St Vincent's, and it's a collaborative centre of the University of Melbourne. The Centre for Palliative Care administers the Palliative Care Research Network, otherwise known as a PCRN. And the purpose of the PCRN is to foster collaborative scholarly inquiry in palliative care. I'll be co-facilitating this afternoon's forum along with Jenny Phillip. Jenny is head of the Palliative Nexus Research Group, and she's chair of palliative medicine for the University of Melbourne and St Vincent's Hospital, partnering with the Victorian Comprehensive Cancer Centre. You'll get to meet and see Jenny a little bit later on, as she'll be facilitating the Q&A session. Before I introduce our first speaker, in the spirit of reconciliation, the Palliative Care Research Network acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. On behalf of the PCRN, Jenny and I are really excited about today's forum, which is essentially about launching a new program of work which focuses on improving consumer engagement in order to enhance palliative care. So this is a great initiative. There'll be several speakers: Stacey, Joanne, Avi and Christine, and I'd like to introduce Stacey as our first speaker. Stacey will then introduce other speakers prior to their presentations. So Stacey Panozzo is the Project Officer for the PCRN Consumer and Community Involvement Program. She's also a Research Fellow working with the Palliative Nexus Research Group that I mentioned earlier on. And Stacey's done an amazing job in a relatively short period of time in taking a significant role in helping to develop this new consumer program. So our hats go off to Stacey already. Just very briefly before I hand over to Stacey, this presentation or the seminar today is being recorded, and it will be available on our website very soon. So if you've got colleagues who were unable to attend the seminar today, please let them know that this will be available in due course. As I said, there's going to be Q&A at the end, and that's really important, I think, particularly in a forum of this ilk, that we get an opportunity to hear from you, the audience. So we really would like your comments and questions. We've got a number of speakers, so I think it's going to be some very interesting discussion, and we would value you putting forward some questions, just using the chat option at the bottom of your screen. And you're welcome to enter those questions along the way, even though we'll be holding off the Q&A to the very end. It would be great if we've actually got a pool of questions from which to draw from. And if you're not sure who to direct your question to, that's fine, that's okay. If you just pop it in there, and then Jenny will do a terrific job, I'm sure, of discerning who the question should go to, or she'll open it up to the whole panel. So on behalf of all of us, Stacey, a very warm welcome to you, and I'll hand over to you now. Thank you very much indeed.
Thanks so much, Peter, and thank you to everyone who's joining us today. This afternoon, it's my privilege to introduce to you two members of our project management team, Christine Hofmeyer and Avi Paluch. And while they're finding their videos and mics, I'll just provide a bit of an introduction for them. Christine has worked as a palliative care nurse consultant for 27 years, and she's provided palliative care for patients, carers and family in her professional role, and helped to inform service and policy development. And she has had experience as a carer for several family members with life-limiting illness. And along with her role as a consumer representative in our program to enhance consumer and community involvement in palliative care, Christine is also a member of the National Register of Palliative Care Consumers and Carers with Palliative Care Australia. So welcome, Christine. And I'll get Avi, seems a bit shy, I'll get him to share his video. Avi cared for his wife, Geeta, who lived with cancer for 12 years. As a carer, Avi was presented with a whole new set of challenges, navigating and juggling so many different roles as a carer, as a husband, a father, and working in many other areas. But with this experience came incredible rewards for Avi in being a carer for his wife, and also, as he describes it, witnessing the beauty of our human spirit through Gita, and also those who provided support for him and his wife and family over those 12 years. So along with Avi's role as our consumer representative in our team, he's trained as a grief counsellor and provides much support to other carers. So welcome, Christine and Avi.
Thank you.
Thank you both for joining us today. I think one of the things we'd really love to hear from each of you about is, firstly, what is it that really motivates you to be a consumer representative in palliative care? Maybe Christine, you can go first if you like.
Yes. Thanks very much, Stacey, and thanks for involving us in this video. It's a pleasure to be here. I guess that I've come to realise through my lived experience, both personally and professionally, that how powerless you can actually feel and how vulnerable when you're actually looking after somebody at the end of their life. And I started to think to myself, and was motivated to join with Palliative Care Australia, and I thought, well, if I can feel like this with all my knowledge and experience, how must it be for other people who have got no experience in terms of navigating systems and accessing care? And so I thought, well, I've got to find a way in which I can actually help in that situation. So that was my key motivation. And I guess all along I realised that people being able to be involved in their care, be the primary person that makes decisions, that their wishes and preferences are included, is key. Demystifying palliative care, increasing awareness and knowledge of palliative care was also something that I felt that I could contribute to as a consumer. And the issues that arise for health professionals in terms of providing care to people at their end of their life can often be very confronting, particularly if they're not working in palliative care. And so for somebody to be actually listened to and heard when they're stating what they want is very important. So these were the key motivating factors in terms of my involvement with actually a carer and a consumer. And I guess as cliched as it sounds, it's given me the opportunity to probably honour all the people that I've looked after, both as family and as patients, in terms of trying to ensure that their experience can be the best it can be. So being involved with organisations and like yourselves and services and helping to develop policy and procedure and providing an understanding of the impact is very important for me.
Yeah, absolutely. Thanks, Christine, because it's so true, like really giving everyone a different perspective or a clearer perspective of what palliative care is so important. And sounds like your lens has really shifted to view and inform care from a really different perspective now, which is really rich. Yeah.
Yes.
And Avi, what are your motivations? What really motivates you to be a consumer representative in palliative care?
Along similar lines to what Christine's outlined, and thank you for the invitation to participate. And like Christine, in my lived experience as a carer of my late wife, among the motivations has been to be able to inform others, joining the platoons of the noble caring role, particularly in palliative care and its benefits, be that for the patient, the carer, the family and friends. given that the field and or tasks involved in the specialised field of healthcare for people living with a serious or terminal illness in order to optimise their quality of life. And I still believe palliative care is a strange word, not really widely understood necessarily just yet. Hopefully over time that'll become more widely known. Palliative care, as I understand it and have experienced, can provide relief from the symptoms and the stresses of serious illness, the goal being to possibly improve, even for a very brief period, life, or rather what remains of the patient's life, as it provides that extra layer of support. I've found by embracing palliative care and learning early on to connect with the local and nearest palliative care service, to subsequently graduate into the role of a carer, should that be your choice. And what I would suggest is, do not leave it to the so-called last minute, because it may enable you and your loved one to be around, it may enable your loved one to be around for a few weeks, maybe a month, maybe even longer, whether that be your loved one is in a care facility or at home. And finally, the palliative care service ought to provide you as carer and or the family with the guidance appropriate as your loved one is nearing the end of their road or their journey, and especially if your loved one is still at home.
Absolutely, Avi, thank you. And I think it's such as you've pointed to, this term of graduating in a way to describe it, a different step to process your experience as a carer and then use that experience to inform and shape the care of others as you're doing. And I think just briefly, one last question that I have for each of you is what's the vision or hope that you have for consumer involvement in palliative care as we move forward?
Okay, I guess the thing is that for consumers and carers, as they see fit, to be actively involved in the development of services, in quality improvement, in research, so that they feel that they are actually can be heard and listened to, and that the point of view of the patient and the carer is understood and valued. I think it's a bit of a myth that consumers particularly don't want to be involved in, say, even research, that it's an onus and a burden to them, but that's been shown to be incorrect, and that people really do want to play a part. And so ongoing education for consumers and carers as to how to be involved and how to get their voice heard, and for all organisations and all researchers to include actively the patient and the carer in the research to help inform their research. And I guess that if you show you've got consumers and carers involved, then potentially your funding is going to increase. You're going to have better access to resources, but best of all, the care of the consumer will improve.
That's right. Yeah, absolutely. And it's that voice that's so needed in this space. And Avi, what are your thoughts about hopes and vision for the future?
That you, the carer, and that your family and the community within which you might be embedded is better informed and or knows and understands that palliative care's purpose, along with enlightening you, your family, as to what you're going to be faced with regarding the challenges and the responsibilities in embarking on this carer's path or journey.
Absolutely.
Secondly, the carers will be better supported with that guidance as you accompany your loved one on their last journey, and returning to the prospect of extending or having your loved one with you, even if it's only a few weeks and more, possibly, especially at home, if that's possible, given that statistics indicate that approximately 70 to 80% of us, according to the statistics I looked up, would choose to be at home on their last journey if that was at all feasible. And finally, that carers and family and friends are better able to navigate their lives through the following grief and bereavement periods and beyond.
Absolutely, Avi. I think as a consumer representative, being involved in palliative care research and shaping service delivery and policy, there's so much that can benefit, as you've both mentioned, consumers and carers throughout their journey. Thank you both so much for sharing so generously today. I know you've raised a lot that helps, really, I think, give us a lot to think about over the course of today's forum and beyond. And I thank you very much. And I know that we'll actually be seeing you in the Q&A session afterwards as well. So if anyone in the audience has questions for Christine and Avi, please pop them in the Q&A. And yeah, we'll look forward to seeing you both again very soon. Next, I'll introduce you. We'll be hearing from Dr. Joanne Britto. And Joanne is a Consumer Involvement Manager at the Victorian Comprehensive Cancer Centre Alliance. She has 25 years of experience in medical research and a PhD in neuroscience, and she's very actively involved in embedding the consumer perspective into program design and implementation through initiatives that really formalise the role of consumers and seeks to establish really effective partnerships. So thank you so much for joining us, Joanne.
Hello everyone, and thank you, Stacey. Really appreciate the welcome and also the invitation to talk to you all today. Before I begin, I would like to start by acknowledging the traditional owners of the land on which you may be joining from today. I'm on the lands of the Wurundjeri people of the Kulin Nation, and I pay my respect to their elders past and emerging and any Aboriginal and Torres Strait Islander colleagues who have joined us today. So I was asked to talk about the what and how of consumer and community involvement, and you're probably wondering, where is the why? Well, I think we all know the why, and it was lovely, and thank you to Avi and Christine to hear you share those reasons why consumer and community involvement is important for palliative care. Next slide, Stacey, and thanks for doing the slide, Stacey. So what is consumer involvement? And I think first, I'm just going to define what we mean by consumer, because this is a term that some people do and don't feel comfortable with. So if we can think of a health consumer as a past, present, or future user of a health service. So that's how we define consumer. So how would you define involvement? And what I'm actually going to do is a working definition. I think if we can apply this working definition in practice, then we would all be doing best practice. And what it is, it's an approach that is based on building a relationship with a shared focus. All of this is underpinned by trust and mutual respect, and it has to involve active two-way dialogue. And I think part of it is, you know, some people may say consumer involvement, or some people may say consumer engagement. The whole point is that engagement or involvement is more than just simply taking part. Next slide, Stacey. So I thought I'd take a step back and go, okay, well, what is consumer involvement in practice? You know, we can be very practical about this, because what is consumer involvement? It's people relationships, it's working relationships. It's not frameworks and models and theories, it actually is embedded in practice. So these key themes that I have on this slide, I could put the papers and the evidence and the publications on where they come from. But I just thought, for simplicity, let's keep it nice and simple and just break through what are the key things around practice, good practice with consumer involvement. So I think language to start with. I've already mentioned I did a definition about consumer at the start, because some people may not identify or associate with the term. So what terminology you use? Any language needs to be accessible. If you are asking someone to contribute, they need to know what they are contributing to and how they can contribute. And that leads to the second component of clarity. Having really clear expectations of the role. And I think Avi picked it up. Involve early. You know, you were talking about palliative care, but I think having a consumer voice in any project design, involvement early can remove that idea that it really is a tokenistic effort in involvement. I like the idea of a multidisciplinary team. And we know that throughout health services, this is a really key thing, to bring in the experts of multiple disciplines. And if we were to think that a consumer brings the expertise of a lived experience, it's that deeper understanding of our lived experience, then that's like another voice as part of a multidisciplinary team. But when you bring in that voice, there's the question on what are you prepared to change and how can it be used in priority setting? And that is to, you know, what you will be listening to and how you want to act on it. Assumptions is a big thing. We all bring assumptions. In the community, you know, some people feel that you cannot ask people to participate in research. But regardless, we need to make it safe and accessible. If consumers are going to be involved, they're very key elements. Recognition is important in any culture. The right acknowledgement, if you're involving someone in any project, you close the loop and you provide them the support so they know what contribution they're making and how it's being acknowledged. And I've just put lastly there remuneration. And what that is financial recognition for contribution. Very different to reimbursement, which is paying for out-of-pocket expenses. This is actually paying for the time that someone is contributing to a project. Next slide. Now I thought I'd take those same themes and now put a lens of palliative care. And I have to admit, from what I know, which might be minimal compared to this audience, but what I am learning about palliative care is that it is patient-centred. When you're talking about quality of life, the patient or the person is the #1 priority. Also, the approaches people take, very holistic in nature. So there seems to be always this focus on the patient, the family, and we'll just say consumer. But there is something about having someone with that deeper or depth of understanding, that lived experience, that actually can enhance that. And so to think about palliative care, the language, it is emotionally a demanding topic, how people talk about it, how people frame, and the sensitivities around it. I think sometimes language can be very common in the professional setting and we get used to what language we're using, but when we bring in consumers, we need to be very conscious of how words are powerful. Clarity, in palliative care, you may be looking at someone who is a patient or you may not. An informal carer, a non-paid carer or support person may be the best voice that you can bring in to guide your research questions. Multidisciplinary team remains the same. The assumptions are different though, and I think this is where, when we think of palliative care perception, community perception of palliative care, the recruitment of people, you know, a lot of the ethics will say you cannot recruit people at that time in life. We've also heard from people who do want to be involved. Regardless, there's a safe environment and you ensure that safety. And I think we've all learnt in the last couple of years about providing alternative means of connecting. So flexibility of movement is important. And those last 2 points remain the same. Next. So what is this structure? I think structure is important because it helps with that clarity of roles. And the schematic I've shown there is an example of our framework that we use at the Victorian Comprehensive Cancer Centre Alliance. And it involves 5 levels of participation. Why do we segment? It's actually for our own minds to be able to prepare people. And if you could just click, Stacey, the whole point of having these levels, it helps us to tailor the participation from both fronts, from the researcher perspective as well as the consumer perspective. So you can tailor communication, preparation, resourcing, development, remuneration, and evaluation. Next. So when you involve someone, I wanted to make a bit of a definition and a distinction here. So consumer involvement is not the same as a consumer participant. So the research cohort that you may be using as part of your research, that's actually different. Consumer involvement actually is about a consumer being part of a decision-making process, as being part of the project team. And one of the things that we do when we look at the model, and you can see there the 5 levels of participation, are the different types of activities that consumers can be involved in. So we kind of view this now as being research conducted with rather than on consumers. And there's this idea of switching from consultation to co-production. Next. So this is the last slide, and I really think it's thoughts around how to set up for success. So start the conversation for the long-term strategy. It's not the breadth of the project or the grant funding. It's actually, if you're in organisations, and I think this network is a great opportunity, think of the long-term strategy of how you can involve consumers. It's about incremental development, and I put there it's for consumers and the researchers. Both need skill developments to be able to do this well. We talk about recruitment, and this comes up every time. Consumers and matching consumers to the project is really crucial because we know consumers and research questions are unique. Recruitment also is this thing of, you know, how and when to approach, you know, how do you frame it? What is the timing of when you approach someone? And we have 2 consumers on this panel, and I hope we explore more this discussion because I think this is an area that could really do with their input, and then I can also add more ideas. Flexibility and engagement, we need to be adaptable. Involve consumers early, avoid the checkbox asking for a signature at the end of a grant. This is about being effective and meaningful. And we know best practice is to involve at least 2 consumers, provide peer support for the consumers so that they can also interact and contribute together in a project. You may join resources. Maybe it's not an individual or 2 consumers as part of a project, but you might set up a consumer advisory group that a number of research teams can ask that advice of and utilise across the projects, and really get that expertise of a lived experience from the consumers themselves. And I'm saying this because you have the researchers on site. Evidence of change. I think one of the reasons this area doesn't progress as fast as it can is because that evidence is not available. So evaluation is also key. Next. Lastly, this is just my details. As mentioned, I'm the Manager of Consumer Involvement at the Victorian Comprehensive Cancer Centre Alliance. There's my email address and all the resources that I talk about. We have an online open access toolkit, and you can access that. And I will say, I sit here and I talk and I say, oh, do this, do that. Is it easy? No. As in anything in research, with careful planning and resourcing, it is a possibility. So I'll end there, and thank you very much.
Thank you so much, Joanne. That was so fantastic, and it's such such a thorough way to actually give us a view of like where and in what ways, because we all, as you've mentioned, we all really know why we're interested in doing what we do or becoming involved in this sort of space. So I'll spend the final amounts of our time together this afternoon just to share a little more about our program that seeks to enhance consumer and community involvement in palliative care. Although the specialty of palliative care, as it's been pointed out earlier, is very much philosophically consumer-centred. We're very patient and carer and family-centred. We know from the literature that involvement of and partnership with consumer representatives in palliative care is less than advanced compared to, or less advanced, sorry, compared to other areas of health and social care research. Both in Australia and overseas, it's still more of an emerging practice that has been increasing over recent years. And some research and health professionals still actually have a reluctance to involve consumer and carers, often reporting that it's complex and or too difficult, and perhaps perceiving that consumers and carers are too vulnerable. And certainly that myth has been addressed by Christine and Avi earlier. There's also, as Joanne has pointed out, there's little known about how we can explore the impacts of consumer and carer involvement in research outcomes and palliative care services over time. So this is a new program of work that we've been co-designing and developing together, certainly throughout this year. But I know Avi especially could tell you, and he's a very patient man, because many of us consumers and researchers alike at St Vincent's and the University of Melbourne have really desired to pursue this sort of work for some time. We know that there are a small number of really well-established and dedicated consumer and carer advisory groups actively contributing in palliative care across Australia at the moment. And this program of work by no means seeks to detract from these, but to add to this great work with a research focus. So over time, our aim is to develop and implement and evaluate a program to enhance consumer and community involvement in palliative care in Australia. And the phases there, or objectives, if you like, of this program, phase or objective one is to establish a special interest group to help facilitate consumer and community involvement in palliative care. Phase two, it looks to co-design, develop and co-implement a model of consumer involvement and a suite of resources that are quite specific to palliative care for consumers, researchers and clinical service leads. We're also in phases 2 and 3 looking for opportunities to further training, empowering and increasing skills for research and clinical service lead staff to really help create more involvement-friendly organisational culture within our palliative care research. And in phases 2 and 3, we're also looking to increase an understanding and strengthen the limited evidence base that we have around the impacts of consumer involvement in palliative care research, seeking to build that empirical data to underpin the activities that are happening. So all of these, this is a bit of a busy slide, but all of these sort of sit in those last 3 columns, the grey area of this slide. These phases or objectives, if you like, are spread across over the next sort of 3 to 5 years, with each phase serving to inform the next. And obviously with the establishment of the special interest group being key in this early piece to move forward. So we're really embarking on phase 1 at the moment, this first year of the program of work. So I'll focus today in the final minutes on this phase, and whilst we haven't yet any formal results to share, this will focus on the activities we're undertaking. So this year, or this first phase, is very much around a baseline mapping of consumer and community involvement. We're really seeking to understand and identify what these activities currently look like in palliative care. So with the 4 objectives that are listed there for this particular first 12 months, I'll just unpack these in more detail with you. So So part of this baseline mapping will involve conducting interviews and exploring the perspectives and experiences of several different groups. We're wanting to speak with those currently involved as consumer engagement coordinators, such as Joanne and others. So not necessarily those only in palliative care, but to take the opportunity to speak with and to learn from different engagement and coordinator staff across other health and social care disciplines and settings. We'll look to interview consumer and community representatives who are currently involved in palliative care research, and we're looking to those who are partnering and already involved with palliative care researchers and educators and wanting to explore their perspectives, what their experience is, what the perceived opportunities and challenges are for them, and also for consumers to recommend what would really enhance their involvement moving forward. And we'll also seek to speak with palliative care researchers, educators and clinical service leads who are really proactively working together with consumers and carers and explore their perspectives and also their future needs as well. So I'll pause for a moment in my description to actually reach out to the audience now and say, look, if you are a palliative care consumer representative, if you are involved as an engagement coordinator in some capacity, or if you're in a palliative care research educator or clinical lead space currently working with consumers, we would really like to speak with you. And if you're interested in participating in an interview, please reach out. The next phase of really drawing a sense of a baseline of what activity is involved, we're looking and spending time at the moment reviewing 12 months of peer-reviewed original research, looking at how consumer involvement is reported, if it is reported, and if any impact is or evaluation is had and present in the publication. So we know from literature that the quality of reporting within research papers still remains inconsistent, even though consumer and carer involvement is sort of expanding in other areas of health research. It actually, without the presence of this sort of information in publications at the moment, it limits our understanding of how consumer involvement works, in what contexts, and for whom and why. So we're using a modified checklist to guide our extraction across 3 major international palliative care journals, exploring if, where and how consumer representative involvement is reported. Already at this early stage of the review of 200 plus original research articles, there's only around 11% at this point that are reporting consumer involvement in some way in their paper. So that could be as much as co-authorship and reference to consumer involvement throughout the article, all the way through to a short acknowledgement in the short acknowledgement area at the end of the publication. We're also seeking to establish a baseline of current consumer involvement in palliative care clinical trials across Australia, the UK and the US. And we've identified around 900 active palliative care clinical trials through the trials online registries. We're seeking to to survey principal investigators or lead investigators of these trials to really explore where consumer involvement is at in the clinical trials research space, and to seek recommendations for how to further facilitate and enable consumer involvement in trials from design through to dissemination. And throughout this early part of next year, we'll also be establishing a special interest group that will co-design, co-implement and ensure co-knowledge translation of outcomes as we progress through each phase of this program of work over the coming years. And this special interest group will include patients, consumers, caregivers and community representatives. researchers in palliative care, also clinicians and others supporting patients with life-limiting illness and their families, and also palliative care educators. So we'll make a call in early 2022 through the PCRN newsletter and online for expressions of interest if you would like to become a part of this program of work. I think Jenny's going to join us now for some Q&A time.
Thank you, Stacey. And I'd invite Christine, Avi and Joanne to come back online, and maybe we can reduce the slide thing. Thank you. Thanks for terrific presentations. And I've been trying to monitor the chat. It's been very vigorous. So I hope that I can field some questions, and we'll cover some. And I hope that, in fact, some of this conversation will continue in different forums, you know, in the future. Some of the questions that have been coming up, I am conscious that there's great experience out in the audience as well. So I'd invite you to respond to the questions and put your answers in as well. Thank you. One of the questions, I've been trying to group them in my mind, but one thing that's come up is around how is the best way to support consumers who may be, for example, on a research team. Joanne, you talked about a number of areas around ensuring language and making sure to consumers, but I'm wondering if there are any other specific things, perhaps Christine, that might come to mind that you would think would be helpful to have or to think through if you're on a group of people and you're wanting to make sure that your experience and your insights are maximised.
Yeah, thanks, Jennifer. I guess in the groups I've been involved with so far, I have certainly felt valued and listened to. I've been considered as part of the team, and that has been achieved by people seeking my opinion and listening. Was certainly. I've had training as a consumer, and that helps considerably in terms of actually being involved as a consumer. And I guess that what I've also done after each sort of session I've had with, and it's all been Zoom, with the key coordinator, is actually just emailed them with statements about what I actually said and reinforced my view. And I think that's an important aspect, because then you've actually put it in writing as well. But certainly it's a lot of people have reported that they feel as if their input is just a tick box. And so it's really important that the consumer actually has some education as well, even if it's just prior to the research group starting. A lot of information about what's going on is helpful.
Thank you, Christine. That's really helpful. I wonder if it would be useful to maybe have a specific agenda item on the meetings, for example, of additional insights. Would that be helpful, or would that be, is that something that could be considered? Anyway, I guess that's a thought. Do others have anything you'd like to add to that?
I can add. I just wasn't sure if Avi wanted to say anything around this topic. No?
No.
No. One of the things that I'll pick up with what Christine said, and one thing that we've been doing at the VCCC Alliance is this idea of a pre-meeting and a post-meeting, because sometimes when you bring everyone together, so everyone's filling in their calendars, you've got 1 hour, you've got 60 minutes, and the meeting can be quite high-paced. So like you say, Jen, having an agenda item can help, but sometimes consumers can feel that a bit intimidating because they feel that they have to. Also, they may not feel part of the project team because they feel they can contribute at all agenda items. So there's really mixed feelings about that amongst our consumer network. But this idea of And it's that relationship. How much information does the consumer require, or even give them more information? Because people like to read, and I think sometimes we can make an assumption, oh, they won't understand it, they won't this. Have your pre-meeting, ask the questions beforehand, see what knowledge gaps might be missing, so that when that contribution happens within that short hour or 30-minute meeting, you know, it's kind of planned. And I think, Christine, I agree, recognition and feedback is really important to know if you're on the right track. And if you're not on the right track, that's fine too. You're supposed to challenge. That's part of the consumer role.
Terrific. Thank you. Thanks, Joanne. Avi, one thing that that Joanne raised that I think is a really important question that challenges us a little bit in palliative care is it's a notion of perhaps when, but also I'd like specifically to think about how is the best way to approach someone to ask if they'd be interested in being a consumer, particularly perhaps you know, in the palliative care sort of setting.
I suppose it depends on what sort of relationship you have with who you're engaging with, and be culturally aware of who you might be talking with, and try and be succinct, and maybe engage in a short discussion to try and draw out what may be the core issues that need to be dealt with.
Thank you. Great. Do you have anything that you would add to that, others on the panel? Christine?
Yeah, I guess that I responded to a sort of overall request from Palliative Care Australia, and then the invitations since that, I have actually had the opportunity to have a pre-meeting with the researchers or the organisers of the groups to get an understanding of what they wanted and to ensure that I felt that I could contribute effectively. So I think there needs to be some matching between the project and the consumer, as Joanne mentioned. And I guess not take away the concern that maybe the person's not going to be ready, or is it too early, or is it the right time? Because then the consumer will soon tell you if it's not the right time, if it's not working for them. And as Joanne also said, there has to be some flexibility, because sometimes if you're actually a consumer, there may come a time when you're not going to be able to be involved, or the carer is feeling pressured at the time and can't manage it. So with that realisation that the consumer and carer may have to dip in and out at some point as well.
Thank you. Thank you both. That's very helpful. A question that has come up in the Q&A, which I would actually also value the audience's responses to. One thing about palliative care in particular is that often it's the carers who are the ones who are becoming the consumers, and for obvious reasons, patients are ill, navigating all sorts of things, as are carers in navigating it with their patients. Mm-hmm. But this is a thought that we are uncertain about, you know, what we should do about that. And I think it's an ongoing challenge, and I'm not sure that there is any answer, but I wonder if there are any novel ways that we can also have the palliative care person voice at the table. I'm not sure if there are thoughts on that. Stacey, I see you've unmuted.
Yes, sorry. I just wondered, there's an experience that comes to mind from a previous project we've had where we had 3 amazing consumer representatives, survivors of and/or current patients experiencing cancer, because that was very specific to the project, and matching, as we've spoken about, matching consumers to the focus of the research. And one consumer, unfortunately, about halfway through the project, his condition declined. But prior to that, even through active treatment, he was very, very engaged. It was really important as a professional with a consultancy type background. It was incredibly important to him to be involved and to really use that quality of life that he had even through treatment, to be able to have his voice heard and to make an impact beyond the treatment and survivorship experience that he was undertaking before that decline. So I think it's incredibly important, and it really is, as Christine's pointed out, it's where we can make a request, and it's that person, and for us to always engage and manage, which is what we did in that project, where there is a point at which the patient or the consumer can no longer have the capacity to be involved, that we step back as well and have that.
Thank you, Stacey. So there's so much in what you say, but I also am hearing that there's a great responsibility and a great sort of richness available to us all if we ensure that the ways that people can participate are as flexible as possible, and such that their voice remains heard. Thank you. One of the, and I think it's going to have to be the last question, for which I'm really sorry, because there's so many great things coming up, but one of the themes that are coming up is around this issue of advocacy, both advocacy for better sort of access to resources and support at the end of life for people at home, advocacy for understanding palliative care itself. And this is a very powerful role, I anticipate, for consumers. And I'd like, if I may ask, Christine, Avi, and then Jo to perhaps comment on this. Christine?
Yeah, so just checking in terms of the importance of advocacy, or how to be an advocate, I guess.
Yeah, I think maybe, yeah, sorry, I haven't asked a quick question. I guess, could you speak to how you see your role as a consumer advocate?
Yeah, I guess that, as I said right at the beginning, the key thing for me was to increase awareness of palliative care and to help people navigate systems and care. So, because it can be very stressful at the end of life, and then to actually actively seek out ways in which you actually can contribute. And I was amazed once I joined up with PCA just how many consumer groups are actually out there, and how much involvement there already is of consumers. And so don't wait necessarily to be asked. Look at who is conducting research, where consumers are involved, what groups they are, like the VCCC and even Nexus, and putting your hand up and saying, okay, I want to be part of what is happening, so that I can advocate for carers and consumers. Does that answer?
That's fantastic. Thank you, Christine. Yeah, I'm sorry I'm asking perhaps an unfair question. Do you want to have a go at that? How do you see your role as an advocate?
I'd echo what some of what Christine's put forward. I think it's important. I tend to be a little on the shy side. Important to try and build a little bit of courage to step forward and try to participate and contribute. It's not always easy speaking publicly, as we're endeavouring to do, as I'm endeavouring to do. But I think it's essential that consumer feedback, because as a carer or as a spokesperson of who you may have cared for, being able to share whatever the experiences are with other prospective consumers is so important.
Thank you, Avi. And Jo, last comment on consumers' voices as advocates?
Yeah, an untapped resource. I think what is really important, the consumers come as advocates because they're from their lived experience, they want to make it better for the next person, or they want to give back. And I think this idea of advocacy is really providing opportunities for that. And in the model that we have, the very left-hand side is informing. And I think that's a very key role for organisations. If we can bring the conversation to the public, this also helps with, government advocacy. If we base it in reality, what is it all about? Raising that awareness. I think people, if they, might not know where to go, they find a path to go. And I think it's opening that kind of path and making it as easy as possible so people can contribute. And I think, Stacey, you putting up your slides, I can already see in chat and Q&A people are coming forward. So that model I show, even though, consumer-led, everyone's like, that's the important part. I'm like, no, every part has value. And I would say informing is highly important.
Terrific. Thank you, Jo. So that brings us to the end of today. I'm sorry I've gone a bit over time, but it was just this wonderful set of questions and possibilities. So thank you to everyone for being so active in their participation. I would like to thank our panellists and our wonderful presenters, Christine, Avi, Joanne and Stacey, for really a great conversation today and for kicking off this tremendously important piece of work. Stacey has put her email in the chat, and I think we're going to put it up on the slide again. If people are interested, please make contact. You might be interested in finding out more or being involved in a special interest group and or participate in the interview. I'd like to thank you, the audience, for your great participation today and for coming along and being part of today. And I hope this is really the beginning of, a regular conversation with you all, and both to show you and involve you in this work as it unfolds. Thank you to Alfie and to Tanya for all your organisation behind the scenes and for making this so seamless. Please email us if you want further information, and there will be a recording available of this on the website in the next week or so. So thank you, everyone. I'll bring the session to a close, and I hope you have a wonderful day.